isn't a member and is interested in becoming one, you can contact Sharon. She'll put her email address in the chat box for you. So being a member isn't an onerous task, but it is an essential part of the hospital's future as a foundation trust. And it's through the Council of Governors that members are given the opportunity to influence and have their say about how the hospital is run and the various services offered. So membership doesn't cost anything, it's completely free, and you can have as much or as little involvement as you choose. And there are quite a few benefits to being a member. I'll just tell you a few of them. You get lots of information about the Trust's activities and various member events. You can have an active involvement and share ideas for how services can be improved. And that's always very gratifying to think that you can have your voice heard, I always think, as a member. So you also get the opportunity to influence the way local services are provided and new ones that are developed. You can attend meetings like the Council of Governors and the annual members meeting, and then you can learn more about what the Trust does. You've got exclusive online access to health service discounts, and you also get invited to attend free events such as tours to see behind the scenes of the hospital and health talks such as today's. And you also get to play an active role in deciding who is elected as governor. And you're also eligible to stand as a governor yourself if you want to get more involved. Right, so we move on to today's talk, which is about the support offered to unpaid carers. So we have Tanya Curry presenting to us today. She's head of patient experience and engagement, and she's carers lead as well. So Tanya, by background, is a nurse, but she's worked in many different areas of the Trust and in some senior positions as well. She's been head of patient experience and engagement for 5 years, and her role involves working closely with the PALS department and the various clinical departments and divisions to understand any feedback that's being shared by patients, families and carers. So she's very much our interface into the people who work in the hospitals. So she looks at key themes that may be identified, and then she works with relevant staff and people to make improvements to the care. So her role is really diverse, and she gets a good overall view and gets involved in a lot of various aspects and areas of patient care. So I'll hand over to you now, Tanya, to begin your talk.
Okay, thank you very much. First of all, can everybody hear me?
You're very faint.
Very faint, yes.
Okay. Do I need to come closer to the microphone, or is that better?
No.
Is it still faint?
That's worse, actually.
Oh, is it? Strange. So my microphone is on, everything.
We can see your slides now, but we still can't hear you.
Okay, can you hear me now?
I can hear well.
You can?
Yeah.
Can anybody, is it better now? Can you not hear me, or? I can't hear anybody telling me that you can't hear me, so.
Yeah, Sharon was speaking on mute.
Sorry. Yeah, it's a little bit better, but you might just have to shout, Tanya. I don't know why it's not very loud.
I'm on my laptop, but it should be all right. So everything is saying it's on. I've checked all the audio settings. I can't see anything else that I can do.
But it's fine. It seems to be a little better now, actually.
Okay, right. I'll just talk quite loudly then. So,
All right.
okay. First of all, also apologies that my colleague Rachel Palfreman, I think you understood that she would be here today as well. And Rachel leads on discharge and support for carers. Unfortunately, she's not very well today, so she's not been able to join. But I can talk to you about the work that we do in the hospital to support unpaid carers. And probably best if we have questions at the end, if that's okay. So for those that don't know, what we consider to be an unpaid carer is someone who cares for someone unpaid. You know, and that might be a family member, a friend, and that person wouldn't be able to manage without them if they weren't there to support them. And this can apply to young carers as well, and to parent carers. So not just you know, normal sort of working age people. It can actually be anybody at all. And it's estimated that £162 billion a year is contributed via unpaid carers. And that is just an estimate because we actually don't know how many carers there are in the country. And that's because a lot of people just don't recognise themselves as carers. And so that's why partly it is really, really important that we do work to improve the support for them. I think you can go to the next slide. Oh, it's just there about the £162 billion a year.
Okay.
So just adding to that, really, 3 in 5 of us will become a carer at some point in our lives. I've been a carer in the past, and I'm sure some of you here will have been or will still be. And it's estimated that there is 6.5 million carers in the UK. But as I said, we really don't know exactly how many there are, because lots of people just think, well, I'm his wife, or I'm the husband or the son or the daughter or whatever, and they don't realise that they are in a caring role. And as you would expect of HATS, we've seen a surge in the number of carers who are themselves over the age of 65. And that's because obviously we have a growing population of people that are elderly, people are living longer. And so we now have people, you know, well into their 70s who are in caring roles for people into their 90s. The caring role can happen gradually over time. It might be that the person you care for perhaps has something like a dementia diagnosis that develops, and over time the condition worsens and you start to become their carer. But it can also happen quite suddenly. So if somebody was to have a severe stroke, a car accident, a mental health crisis, you can become a carer basically overnight. And obviously that can be really, really challenging. And we know that about 1 in 7 carers are juggling their caring role with paid employment. So they're trying to maintain their job, but also care for somebody at home. And these caring roles, they can really take their toll on people. So their personal finances, it may be that they can't work the number of hours that they need to work from a financial point of view because of the caring role. They quite often withdraw from their own sort of social life and the things that they like to do. And particularly with young carers, people withdraw from education, people withdraw from employment, and all of these things that people are unable to do really affects their general health and their well-being. And we see carers that feel very stressed and very guilty. They feel like they are trying to balance too many things, and if they go out and do something for themselves, they then feel guilty that they're not there providing the care that is now become expected of them. The next slide, I think. So from a hospital point of view, it is really important that we support carers, but it's also really important that there is support out in the community to support carers. The picture there is of our Carers Charter, which is our commitment to provide support And as you see there, it says about identifying and signposting, working as partners in care, empowering and supporting, and listening and learning. So if we support care as well, both in hospital and in the community, that can really have some benefits. It can help to prevent hospital admissions and reduce readmissions. It can help to facilitate timely discharge because we can feel more confident that we're discharging somebody to a safe environment and they have care with them, and those carers feel supported and know what is expected of them and have all of the right information and support around them. It can improve communication. Obviously, carers are quite often the experts in that patient's care, and they can work really, really closely with our staff to make sure that patient's individual needs are really understood by our staff, and there's much better communication because they know what's normal for that patient. And ultimately, because of those things, there's better health outcomes for both the patient and the carer if we provide the right support. And of course, there's often a cost implication. So if we get things right, we can reduce those additional costs that are related to additional primary care, additional care services, the money we spend on care, and the delays in transferring people out of hospital while they wait here. So lots of good reasons why we need to really, really support carers. So the next slide, please, Sharon. So here in the hospital, we've done quite a lot to try to improve the care that we provide to unpaid carers and the support that we offer. So the first really important thing is that we try to identify them because as I've already said, a lot of people don't recognise themselves as a carer. So as part of our nursing assessments and on our electronic patient records, we record and we ask the question, is somebody a carer or do they have a carer? So that we can record that and we know that somebody is a carer. And then once we know that, we can, start to make sure that they are provided with the right information. So the ward staff might provide them with an information pack that they have on all of the wards that provides some just really basic sort of signposting to external organisations and the support that we offer in the hospital. We also have information boards on our wards that again signpost people and lets them know the support, the information, the advice, where they can go to get all of that information that's going to support them in their role. I have some volunteers who work with me and they are really proactive at going out onto our wards and going to those people that we've identified as carers, but also going and having a chat with anybody else that might be visiting and just having that conversation about whether they're in a caring role, whether they realise they're a carer or not. And obviously, once we have recognised them, we can make sure that they've got the information that I've mentioned. We have something called a carer support passport, and the picture there of the 4 different pages, I appreciate you probably can't see that very well, but that is our carer support passport. And that's been developed over a number of years with the input from people with lived experience from carers themselves. And the passport, it's been refreshed in the last few months. It's really designed to help us to work together with the carer so that we are working in partnership and we are recognising their expertise and we are trying to involve them as much in the care. So it encourages a conversation with the carer, with our nurses, to talk about what they want to carry on doing. Now, obviously, if somebody is a carer and their careful person has come into hospital, they might very rightly feel that they need a break and that they don't want to come in every day and carry on their caring role. But also a lot of people that do the caring roles every day at home, they want to carry that on and they have concerns if they don't do that and they want to be involved and they want to help us. So we have those conversations to agree what level of care they want to carry on with. And so we document that on the carer support passport. And as part of that, we might issue them with a carer ID badge so that when they're coming and going on the ward, they don't feel like people are wondering why they're there all the time. We offer really flexible visiting, so if they want to come in every morning and help wash their care for person, for instance, or if they want to come in every night to help settle them down, if they want to stay the night, they can do. We have fully reclining chairs that go into like a bed, and they can be issued with one of those, and they can stay there if they wish to. And the passport also provides things like discounts on parking and discounts in our restaurant. We try to make not the key thing about the passport, because otherwise people just see it as a cheap parking ticket, and that's not what it's about. It's really about that partnership working, that understanding their caring role, and making sure that we are supporting them. And yes, there are the benefits of the parking and the food and meals in the canteen, but that's not the main aim of it. We also have a carers cafe. We currently run that every Wednesday from 2 till 3:30 in our main hospital restaurant. And the purpose of the cafe is to give carers that might be on the ward an opportunity to come down, to get away from the ward, to have a free hot drink, to have a chat, maybe talk to other people in a similar role, maybe talk to some of our professionals about where they can get advice and support and information. Quite often our dementia specialist nurses are there, other organisations come, Carers Together Wiltshire came today, and they were able to provide particular information about Wiltshire care services to carers that attended the cafe today. We are going to be moving the cafe. I'm not quite sure when, but in the next few months, I'm going to have a new information hub, which will be located in the Cherwell unit, which is in the Brunel Treatment Centre. And that's going to sort of act as a regular, everyday information hub, a point of contact, somewhere where carers, relatives can go to get information, and whether that's information about their caring role, whether that's information about discharge, or just general information, they will be able to access that there. We won't have people there all of the time, but there will be signposting and contact information, and there will be lots of sort of leaflets and things that people can pick up. So that's quite a new thing, and just something I'm starting to work towards. And the Carers Cafe will move into that space as well. It's a much nicer space and much better than trying to run it in the main hospital restaurant. So I'm hoping that's going to be really successful. I'm going to work with some external organisations as well, so that they can come in and they can help to educate staff and meet with the public and meet with patients and carers to explain the work that they do as well. And then from a staff point of view, we try to do quite a bit of training with our staff and raising awareness. So, you know, a lot of our staff are aware of unpaid carers, but still some people are not. So we are still, it's a continuous thing that we continue to try to raise awareness, both through, you know, going out on the wards, having education sessions, information on our intranet, and just lots and lots of ways that we do. We go to various meetings to try and get those messages across and make people think about the carer when they are working on our wards and departments. We obviously have a lot of staff themselves who are carers, so we try to support them, and we have a particular carers policy and the ability to work flexibly, and we have a carer staff network where we share any relevant information with them so that they are getting the support themselves as well. We want them to obviously to be able to carry on their role here at Great Western, and we want to support them in their caring roles so that they can do that. And we have champions out on our wards as well. So when we do training, we try to train up champions so they will take that information back to their ward areas and share it with their colleagues as much as possible. I won't say that it's always perfect. It's an ongoing education and rollout and reminder to everybody. But I think over the last few years, we have improved our support for unpaid carers quite significantly. So hopefully that starts to transpire in the experience of carers that are on our wards. I think that's it, Sharon. So
Yeah.
On those slides, we obviously were going to have some more information from my colleague, but as I said, she's not able to make it because she's not very well. So that's quite quick just on the carers. But are there any questions or comments on that?
Thanks for that, Tanya. So if you want to ask a question, if you either raise your hand or if you don't want to ask a question yourself, just write it in the chat box and then we'll read it out for you. It certainly sounds like a really useful service, useful facility, Tanya, and thank you for sharing that with us. I just wonder, who are the champions? Who are they nursing staff or could they be other staff? How do you select those?
That we don't tend to select them, they tend to select themselves, and quite often that's because they have an interest they might have been an unpaid carer themselves, they may know somebody that is, so they tend to sort of select themselves, or they might attend some training and then become very interested and want to help spread that word. So we don't particularly select them. They do tend to be nurses, but not everybody.
Okay, and the opportunity to stay overnight for some carers, I'm sure a lot of people are probably not aware of that.
Yeah.
Do many people take up that opportunity?
Yeah, we have about, I think, 8 now, 8 of those recliner chairs that I mentioned, and so people do stay, and we book those chairs out so we know where they're going and we know who they're with, which patient they're with and which carer is staying. So yes, that is taking up. Sometimes that's in particularly difficult situations like end of life situations, but it can be in other situations where somebody just doesn't want to leave their cared for person because they're used to being with them, and actually that's so beneficial and helpful to the patient and obviously to our staff as well. If that patient, particularly somebody that might get a bit distressed or agitated or wonder where they are, having a familiar face with them just to reassure them is so well, as I say, it's so good for the patient, but really helpful to our staff as well. We would never expect anybody to do that, but as I say, lots of people want to carry on that role. So if they do want to, then we want to make them as comfortable as possible. So
yeah, what about children? Are parents able to stay with them?
Yeah, absolutely.
It's a similar facility.
Yeah, absolutely. On the children's unit, that sort of has always been in place, really, that parents can stay with their children, and they have similar facilities on the children's unit. Yeah.
Okay, thanks. Looks like Sarah's got her hand up. Did you want to ask a question, Sarah?
Are these chairs portable? I mean, do they go actually into the ward where the patient is?
Absolutely. Yeah, they are managed by our equipment library and stored ready for them to be ordered by the wards, and the wards will phone up and say, I need a carer's chair. And they'll go and get one and take it to the ward. So it can go in next to the bedside, and as I say, it reclines right out into a bed so that somebody, can be as comfortable as possible.
That's a good idea.
Marion, you've got your hand up.
Yes, I'd like to know how you can acquire a carer's passport.
Okay, so the passport is available from the staff. So what we try to do is to encourage people to identify themselves as a carer, and that's why we ask that question as well. So as soon as somebody is identified, either they identify themselves or it's identified through the nursing assessment or one of our volunteers has identified them, then they would be issued with the passport. And if any of you ever come in and you are in a caring role and you don't get issued with one, then please say, oh, I think I'm supposed to be given a carer's passport. I think I'm supposed to have that conversation, because as I say, it's not perfect. It doesn't happen 100% of the time, but that is what we are aiming for. We don't have the passport available for people to download themselves because we want it to be that conversation that we are discussing with them their caring role. What are they going to carry on doing when that person's in hospital? Because obviously this is different to just being a visitor. This isn't someone that is just coming in to visit and say, you know, stay for an hour or half an hour or something. This is somebody that is continuing in their caring role and contributing to care while somebody is in hospital. So it is a bit different, and that's why it's important that our nurses have that conversation and issue the passport. Is that okay?
Thank you.
Marion?
Thank you.
Any more questions for Tanya? No. Well, Rachel, who is going to be co-presenting with Tanya, as Tanya said, is not well today, but she was going to be talking about the carer's role in the discharge process. So we'll maybe set up another talk sometime where she will have the opportunity to tell you more about that, if that's an area you're specifically interested in. So in the meantime, is there anything else you wanted to say, Sharon or Tanya, before we call the meeting to a close? So Sharon has put her email address in the chat box for anyone who would like to contact her for more details about becoming a member.
Yep, I've put it in there, and everybody on this call, I think, came through to me to get the link anyway, so they should have my email address. And yes, we can certainly set up another short talk for the discharge process once Rachel's feeling better. But I would like to thank you, Tanya. It has been really interesting. And thank you for everybody who took the time out to attend.
Yeah, and if anybody thinks of something that they should have asked about, or they suddenly, you know, a query comes up with anybody about the unpaid carers work, then I'm assuming, Sharon, if they got in contact with you, you could give them my contact details. Which
yeah,
I don't mind whichever way we do it, or my contact details can go in the chat, whichever is easiest, really, if people want to let me know.
Yeah. Oh, can I just ask you a quick question on the carer's passport? Is that just for if somebody's admitted to hospital? Is that for any outpatient appointments they're taken to?
It generally is for somebody that's admitted. We would like to make you know, we should be supporting carers that come as an outpatient all of the time anyway. But if somebody was coming in, I don't know, for a long appointment or something, then yes, absolutely, we could still issue. And it has happened in some of our departments where someone's come in for a few hours because they're having different tests and things. So they're still an outpatient, but they're spending quite a bit of time here, and the carer is staying. So yes, we would still issue one then.
Okay, thank you.
Right, thank you so much, Tanya. That was really interesting, very informative. And thank you everyone for attending today. We'll call the meeting to a close then.
And enjoy your evenings, everybody.
Thank you.
Bye.
So much.
Bye.
Thank you.
Bye.